Communities around Gauteng are warned to stay away from rivers after a deadly cholera outbreak in the province. There have been 11 confirmed cholera cases in Gauteng and 1 death. Meanwhile, faith-based organizations participating in baptism ceremonies this Easter have been urged to take the outbreak seriously.
As the Easter weekend religious gatherings take place across the country, some local rivers are hotspots for baptism ceremonies. However, the current cholera outbreak in the Gauteng province could be devastating for congregants who might head to rivers. One local pastor says although her church doesn't baptize people in rivers, other churches, however, do.
We've got a space that we've made for our baptism. We've got a big pool for our baptism. But I know of churches that comes in the river more often for baptism. But we're not going there.
Have you heard about the cholera outbreak in Gauteng? And are there ways to perhaps conscientize the community? Because it's not just about the churchgoers. There's a whole community here that's living on the riverbank. Is there any way to notify them that they should not be close to this river?
Yes, we are aware of that, and many people, especially the children, we made a space here at the church for them to play, because we are avoiding children to go in the rivers. And on the roads, as you can see, we're trying to make the channels of the water, not for the water to be in one place, because we are scared of that.
The vigilance comes after Gauteng confirmed 11 cholera cases with 1 death.
The Easter period is a season that is full of many religious activities, including the rite of baptism that many people in the Christian faith undergo. It is for this reason that the Gauteng Department of Health has made a call to faith-based organizations to not put their members at risk and to rather conduct their baptisms in safer environments. Cholera thrives in unhygienic conditions, including untreated water, especially from rivers and dams. And therefore, it's important that those that will be embarking on various religious activities are aware of this.
We will intensify our public education programs to make sure that our residents are aware about the dangers of visiting these and conducting these rituals in most of our river streams. We remain on high alert throughout the Easter weekend.
Another concern is around the safety of congregants who might perform different ceremonies in rivers. This after some baptism ceremonies often ended in devastation. Last year, several people drowned when a baptism ceremony went terribly wrong after heavy rains caused flash flooding at the Yekske River in Alexandra, Johannesburg. Most baptism ceremonies normally take place on Easter Sunday.
Following several drowning tragedies around the country, emergency services have also appealed on churchgoers to be extra careful and to stay away from flooded rivers. Patricia Fasahi, SABC News, Mamelodi, Pretoria.
And now to talk more about this issue, we are now joined by Foster Mohale from the National Department of Health, and he joins us on the line. Foster, thank you so much for joining us here on the late edition. If you can just take us through how widespread is the cholera outbreak in Gauteng?
Good evening, Mbali, and good evening to your viewers at home, and thanks for this opportunity. Let me also to congratulate you for joining the SABC. Yes, as the Department of Health, let me start by wishing all the travelers in the country safer, healthy Easter holidays as they be traveling from one place to another. Secondly, let me also take this opportunity on behalf of the department to urge all people to be traveling from or to endemic regions or areas where there's currently outbreak of cholera to take extra precautionary measures. But in terms of the extent of the spread of cholera in the country, yes, currently it's only detected in the Gauteng province, especially in another city of Johannesburg and Ekurhuleni. But as we know that even up so far, we have not yet found the source of local infections. We've been investigating, but we have not made a breakthrough. We say to all South Africans, regardless of which province they're currently fighting. They need to, those who experience cholera-like symptoms, talk of vomiting, diarrhea, dehydration, and body pains, to visit their nearest health facility for screening and testing, because we say early detection saves lives. As much as we know that we have only detected cholera in Gauteng, but that does not mean other areas are immune from cholera.
And of course, if you can just divulge with us and just tell us which areas seem to be the hotspots in Gauteng. We know that it's so far affected 11 people and 1 death. Can you locate exactly, where that hotspot is?
Yeah, currently, out of all these 11 cases, 8 of them have been detected around city of Johannesburg, around the Ekurhuleni area, and a few, 1 or 2 cases in Alexander. And 3 cases were detected in the under Ekurhuleni, around the Foster Mohale, Wakeville, and Boksburg.
And of course, Foster, once more, as a department, how are you dealing with this outbreak, and how are you responding in terms of the measures you are taking for those who may be infected with this cholera outbreak?
Definitely, as you know, that the cholera spreads mainly through contaminated food or contaminated water. We have been intensifying our awareness campaign, health education, in order to empower our people with health information as far as cholera is concerned, especially the preventative methods, the signs and symptoms, so that anyone who experiences cholera-like signs and symptoms, they don't have to waste their time. As much as we know that the cholera signs and symptoms are not completely different from signs and symptoms of other health challenges or diseases, but we say, please don't waste your time as soon as we suspect that you might have contracted cholera. As we know that currently cholera, it's the outbreak in countries like Malawi, Mozambique, Zambia, and Zimbabwe. And we know that people, they move from time to time, they cross border between South Africa and these countries, especially even now, even worse now during the Easter holidays. People have crossed the border to go and see their loved ones in those countries. They'll be coming back. We say, please do ensure that all our health facilities across the country, they remain accessible at all times. Anyone who experiences any health challenge, whether it's cholera related or any health challenge, they can just go and visit their nearest health facility. At some point, we even managed to put our mobile health facilities, especially in the high volume traffic areas, in order to ensure that those travelers who are traveling on a long distance, who may not have time to go to their nearest clinic or hospital, they can conveniently visit these mobile clinics along the freeways so that they can get assistance as soon as possible.
And Foster, should some churches, opt to have the river baptisms, what are the risks involved?
Definitely, as learning from the experience that we had with the recent 4 cases where all patients admitted that they experienced the signs and symptoms of cholera just after they were baptized, and when they were also directed or advised to drink the same water, that they could not even guarantee the safety of the water. So we say to all religious and cultural leaders who want to practice their cultural and religious acts, we say, please do that responsibly. Put the lives of your followers, the lives of your fellow church members first before you can continue. So if you want to baptize them, please, we cannot, as the department, we don't have the right to stop you. We can advise you to say, please do that responsibly, but also at this time, please don't make your members or your clients to drink the same water that you cannot guarantee, because even us as the Department of Health, we cannot guarantee the safety and the quality of water from flowing rivers and dams like your Yabke and Klep River. So we say, please, if you want water for drinking or for preparing food, just go to the tap water, so where you can be able to guarantee that the water is clean and safe for drinking or consumption.
And lastly, Foster, as the Department of Health, what have you done to ensure that people do know that we are currently facing this cholera outbreak?
We've been, in fact, we're almost in the public space like your SABC and all other media. Also, our health response team, they've been on the ground, especially in the areas where there's an outbreak, where we detected these cases, where we are intensifying our social mobilization activities, our health education, but also as part of our investigation in order to ensure that we continue to raise awareness, we continue to empower our people on what kind of signs and symptoms to look for, and also advise them to say, please, always go to your nearest health facility. Early detection saves lives. We can save lives as much as we know that so far we've only lost one life precisely because of cholera. We can prevent more lives. So one death is too many. We say, please, let's protect ourselves. Let's protect our loved ones by doing the right things. The right thing is saying, if you suspect that you might be having signs and symptoms of cholera, don't waste time. You can save your life and the lives of your loved ones.
Of course, that is Foster Mohale there speaking from the Department of Health, and of course saying that you must be aware, especially if you are in the Gauteng area, be aware of the cholera outbreak.